I'm gonna be talking now about 3 asks, or 3 sort of key topics that you're likely to cover during your visit. I do understand that not every visit is going to have time to include every ask. It really depends on, how that initial conversation goes, whether the legislative staff person has 0 questions about what PH is or many questions. You may spend a significant chunk of that 20-minute meeting just talking about what PH is and life with pulmonary hypertension. But roughly speaking, we're going to be asking for 3 things. The first one is early and accurate diagnosis, and that is going to be focused around this request for a PH program at the Centers for Disease Control focused on early and accurate diagnosis. As a little bit of background, nothing that you urgently need to remember, but the House Appropriations Committee did include some really strong language that you can possibly see here in the teeny tiny print, recommending a PH program at the CDC. However, the House of Representatives also cut the overall CDC budget in their budget recommendation, and so they didn't provide any money for this type of program. So we're actually going to say that to Senate offices and say that we hope that the Senate will be more generous to the CDC, and that in addition to growing or sustaining the CDC budget, that they will also allocate some funds for a pulmonary hypertension program. Number 2, this may be the single easiest ask that you are going to make during these visits, because it is really focused on the stuff that you know, the stuff that you live every single day. This is an ask that focuses on talking about therapy access challenges that PH patients face and some possible legislative solutions that we're hoping that senators will just keep an eye on. There's actually nothing, none of these pieces of legislation are active in the Senate right now. They're all things that have been introduced in the House of Representatives, and we just want the senator to be aware of them and to keep the needs of individuals with PH and other chronic and life-threatening conditions in mind as they're making policy decisions. So you may want to talk about the cost of the disease, particularly this idea of coinsurance and the fact that even somebody living with pulmonary hypertension, they pay a monthly health insurance premium, but then they may even be responsible for 40 to 60% of the cost of their medication. And you can spin out your own talking points, but obviously if the medication costs $100,000 a year, the legislative staff person can do the math on what 50% of that cost looks like annually. You may also want to talk about the challenges that folks with PH are facing with charitable assistance, and the fact that some PH patients are actually being told that their insurance plans will not accept a third-party charitable payment, that if the patient themselves can't pay the bill, then maybe that individual should be looking for another plan. And obviously this is a strategy that health plans are using to move folks who have chronic, costly health conditions off of their plans. They're going to say, well, if you can't pay your bill, you can't be on our plan, see ya. And that, that has the potential to save those health plans money. So it's problematic and something that we want to bring legislative attention to. And then you may also, as time permits, want to talk about step therapy and the negative impacts that requiring someone with a chronic and life-threatening condition to start on a less expensive therapy can have. You can talk about the importance of clinical judgment. Talk about the fact that PH patients respond differently to different therapies, and that any type of disruption in therapy can be potentially life-threatening, or at a minimum can have some pretty significant health impacts on health outcomes. So as I mentioned, there are currently 3 pieces of legislation in the House of Representatives that relate to these issues. One that has to do with capping out-of-pocket costs for patients, one that has to do with ensuring that health plans must accept charitable assistance payments, and one that has to do with creating limits on step therapy. And so you'll have copies of all of those legislations in the packet that you're leaving behind to members of Congress. You can just draw your members of Congress or legislative staff person's attention to that packet and to those pieces of legislation and ask them to keep an eye on them. And then finally, ask 3, and again, you'll have all of this information in a leave behind packet that you'll be giving to members of Congress, so you don't need to know all these details. This is really for your own comfort with however much detail you would like to have in advance. But we are, as time permits, again, going to be highlighting PHA's statement of healthcare principles. Those are things like that good health policy prohibits discrimination, good health policy limits out-of-pocket costs, prohibits lifetime and annual caps, allows young adults to stay on their plan, prioritizes clinical judgment, and of course makes sure that networks are adequate. And so we're going to be drawing attention to these principles in the context of the ongoing conversations about stabilizing the health insurance marketplace, the Affordable Care Act or Obamacare, to make sure that people are able to continue to access their care through marketplace plans. But these policies, while we designed them with the healthcare reform debate in mind, are good policies for a healthcare conversation moving forward. So highlighting these elements and asking that the senator please keep the needs of individuals with PH and other chronic costly conditions in mind throughout policy conversations in the future. A few questions that you may get from legislative offices. A lot of offices will want to know, well, how many people in my state are living with pulmonary hypertension? You will have a handout available to you that highlights that number, or at least highlights the number of patients in the state that PHA knows of. And it's worth making that point that obviously not everyone with pulmonary hypertension, first of all, not everyone with pulmonary hypertension has even been diagnosed, so we don't have a hard and fast number. Second, as much as we would like to think that everybody with PH has joined PHA, that's not necessarily the case. And third, the number of patients living with pulmonary hypertension in a particular state doesn't encompass all of the loved ones, the friends, the medical professionals who are impacted by the disease in the state as well. You may get questions about how much a PH program at the CDC would cost. We're looking at a $500,000 number annually, and there's not a set number of years for these programs. Typically, a program like this at the CDC might run from 3 to 5 years, but that's not required, so $500,000 annually. I'll just say that that's not a big number. It's hard to do justice to sort of how small that number is in the grand context of the federal budget. That's not a big number. That being said, legislative offices are under a lot of budget pressure right now. They're under pressure to sort of balance the scales in whatever they do, and we are aware of that, so they may raise that question, but know that in the grand scheme of things, that's not actually a lot of money. Some offices have been really conditioned to be resistant to working on things that are disease specific. It's a philosophical point of view of some members of Congress, and so you may get a question, probably particularly related to that CDC program, about whether this initiative is disease specific. And the easy answer to that is no. You know, we've talked about pulmonary hypertension. Pulmonary hypertension, as you've heard, can be associated with many other conditions. It can be related to lupus. It can be related to sickle cell. It can be related to HIV. So when we talk about a program that would benefit pulmonary hypertension, we're actually talking about many disease conditions. As you dig into conversations about therapy access and particularly charitable assistance, there are some legislative offices that have been lobbied with a message that charitable assistance is a negative, that charitable assistance kind of tilts the scales and messes up the free market and what have you. And so you may get questions related to charitable assistance that kind of drive to, well, isn't the point of charitable assistance to benefit manufacturers? And the simple answer, and and very clear-cut and very true answer, is there may be ways to improve existing regulation. That's up to the policymakers. What we're there to talk about is the fact that folks with PH, folks with life-threatening illnesses, should not be paying a price for that policy debate in their own lives right now. So work out what you need to work out. We're here to talk about the fact that individuals with life-threatening illnesses need access to their medication. Those medications are expensive to manufacture. They're not going to get cheaper necessarily, or a lot cheaper, even as the field evolves. And our goal is to make sure that folks living with these conditions have access to these drugs. And then I've mentioned a few times, it really happens very uncommonly. Legislative staff again, their job is to take these meetings, to understand the issues that are important to constituents, which is you, and then to report back to their bosses, the senators, with their recommendations. So they're going to work hard to have good customer service skills. Once in a while, but they're people too, and sometimes they had a bad commute coming in, or they haven't had their coffee yet, or whatever it is, and they're just going to be a little off. And in that case, you're really going to kill with kindness. You're going to go in and be as gracious as you can and ignore any less than ideal behaviors on their part, and just try to get through the meeting. You can certainly make a note that it was a less than positive meeting, so that we know that as we're following up with the office moving forward. But really just thank them for their time and move on to your next meeting, and don't worry about that. It's them, not you.